American people. That resistance underscores the urgency of this moment. We can reverse chronic disease, improve public health, and lower costs. And I stand ready to work with this committee and Congress to seize this opportunity to implement and codify lasting generational reform in American healthcare. For our country, for our children, and for the health of the American people, together we can make America healthy again. Thank you.
Thank you, Mr. Secretary. And we appreciate, again, you being here today. I know you've had a long day and been on the Hill, so we thank you for spending time with us this afternoon. I want to mention the chemical abortion, mifepristone. It is, as you probably know, FDA has issued a black box warning. And I'm going to read what the warning says. Serious and sometimes fatal infections and bleeding occur very rarely following spontaneous surgical and medical abortions. Recent data shows that the rate of serious adverse events is closer to 1 in 10, or 10% of women who take the drug. However, at the same time, FDA does not currently require reporting serious non-fatal events. My question is, how can the department appropriately address the risk of chemical abortion drugs to the health and safety of women without the reporting of serious adverse events?
Mr. Chairman, I regret that I can't talk about that issue because, as you know, it's under litigation in Louisiana, and I've been advised by the Office of General Counsel to not discuss it.
Oh, so right now you don't have any about any reporting requirements or any changes right now. Is that are you?
Yeah, they've asked me not to discuss it because anything I say may have implications on the litigation.
Yeah. Okay. Well, I do want to mention, and I understand that, but I do want to point out that modifications issued by FDA under the previous administration created a mail-in order abortion scheme that completely removed the in-person dispensing requirement. It requires no ultrasound, no gestational age confirmation, and no assessment of risk. The black box warning directs physicians to inform the patient about risk, such as severe pain or heavy bleeding, and advise them to bring the medication guide with them so a potential emergency room provider knows what they're undergoing for a medical abortion. And so, even though you can't speak to it according to your counsel, I do want to say that when you do have serious risk factors like ectopic pregnancies, that it's very difficult when you have no requirement there be any physical examination of a woman. And so we would clearly, this is an important issue for many members of Congress, and I would be remiss if I didn't take this opportunity to let you know that some strong feelings on behalf of members of Congress. Let me go to talk about a little bit rural health care, as you mentioned. Hospital leaders in my state of Alabama have documented for decades that Medicare hospital wage index is seriously flawed, that it is heavily distorted by exceptions, and it creates a self-perpetuating disadvantages for low-wage and rural states. And that results in, I know in Alabama alone, hospitals being paid substantially less for providing the same care. My question is, how is CMS evaluating whether the current wage index methodology accurately reflects true labor market costs today?
Mr. Chairman, as you know, the Social Security Act makes it requires any changes in the wage area index to be budget neutral. And so making changes in it is very complex because if you raise somebody's compensation, you're choosing to lower somebody else's compensation. And ultimately, this is it's a problem that is, as you say, helping to destroy rural hospitals. We've lost 120 rural hospitals since 2010. But it's something that we can't fix at HHS. We need Congress to intervene, and we are here to provide technical advice and to work with you to make sure that we get something that works.
Yeah, well, like I say, in CMS and evaluating whether the current wage index methodology accurately reflects the true labor cost, I think that's something that should be looked into if they could look at the true labor cost, and then they could help Congress determine a statutory solution to it. So getting that information to Congress and how it is substantially different for rural areas and how that methodology doesn't really reflect the true market cost, I think is something that the department could take a look at. Do you agree?
I'm happy to work with you and to bring Dr. Oz in to work with you on possibly developing that kind of study.
Then that's what the request would be, is we want to, have the information so we can, where the information's laid out, so Congress, if it need to be, we can determine statutory solutions to it. And with that, I will now recognize the ranking member.
Thank you, Mr. Chairman. I would just make this reference to you. This is a different tack on rural health. There's a $50 billion rural health fund. This article talks about is coming up short, and that will be a very detrimental effect on rural hospitals and their abilities to stay open. My time is limited, Mr. Secretary, so I'm going to ask a couple of quick yes or no questions to start. Tobacco is the leading cause of death and disease in the United States, killing 500,000 Americans every year. Do you think it's important to prevent youth from starting to use tobacco? Yes or no?
Yes, I do.
Okay. Do you think it's important to raise awareness about pregnancy-related complications that lead to women dying? Yes or no?
Yes, I do.
Okay. On April 1st, it marked 1 year that American taxpayers are paying nearly 300 CDC staff, including those who work on tobacco prevention, maternal mortality,